Tsothohrhkó, Today I have some very important information to relay on behalf of the Kahnawake Education Center and for our community schools. As well, I also have information to relay that will be also information relayed through a collaboration with our new Associate Director of Education, Falen Jacobs, who will provide further information on our reopening and guidelines that will be more specific to parents and what expectations will come from that collaboration. So today I'm pleased to elaborate a little bit more on a communique that was released today, this afternoon at 1 o'clock, regarding the reopening plans for our school for this coming Monday, January 31st. So as the information has been relayed, is that we have made a decision to reopen our schools fully for our regular on-site learning on Monday. And I want to provide a little bit more information as to what transpired within these past 2 weeks in terms of information that we used to make that decision. And what the current status situation is within our school, because we have been really impacted by some changes that have occurred within this past month. So first of all, I'd just like to bring people back to this situation in January, where the Kahnawake Education Center had made that decision along with collaboration with local public health to extend reopening, delay the reopening of our schools. And following that, to make a preliminary plan that would make a gradual re-entry to come back into our schools. So I'd just like to give you information again as to why we did that. If we look back at December and January, where we were in the community in terms of COVID, is that we knew that there was a high number of individuals who had contracted the virus. We knew that with gatherings we would anticipate that there would be more cases that we would potentially be seeing because of the Christmas holidays, travel, and so forth. One of the other things that really has impacted our schools is also the inability for our children and community members to have access to the PCR test. We know that that test is now only accessible to select groupings of essential workers and so forth, but at this point in time, the only indicator we have for our schools, for our parents and community members, the administering of the rapid test. So with all of this information, accessibility, we knew that it was really important that we had to make some changes to our protocols, guidelines, and information in terms of returning to school and how we identify individuals, our children, with potential COVID-19. So this allowed us that time to be able to look at our guidelines, look at what was happening. So I'm going to give you a little bit of information about these past, I'll say we're close to 2 weeks that we have now had a majority of our children back in the elementary school, and we are now at the point where we have groupings of high school students who are in our high school at this time. So what data were we looking at? What information led us to come to this decision now that as of Monday we will be reopening our schools? And that's the information that I would like to share with community and parents. So one of the first things that we knew we had to monitor during last week and this week was the amount of cases that were identified as COVID-related cases within, whether it was either in the students or in our staff. So it was really important, number one, that we relate to parents how they would identify children, their children with COVID, and of course that is mainly right now through the rapid test to administer while monitoring the symptoms that their children have, and the same for obviously anyone else in the household. With that, We clearly relayed processes. We had to discuss and develop guidelines of how we can communicate with parents, and what are the isolation guidelines and so forth. And that's something that Falen Jacobs will be able to give more information about those procedures to family right after me. But the data that we collected is that what we did see as of last week and in these past few days has been that there were more instances where our staff did have identified as COVID-related, had COVID-19. There were impacts to our resources and so forth, and able to administer some services. But overall, we managed fairly well during this period. What we did see that really reassured us and really was the indicator that we could open our schools safely was the fact of the positive cases that were relayed to us from parents of students who had COVID-19. What we did find out, and when we looked at all the data and the information, is that we did have a very minimal cases during this period. What we did have is cases in one elementary school, and of those cases, what occurred is that in the situation and in that particular classroom, it was quickly handled. There was no spread within that classroom afterwards, and we monitored that classroom closely. All parents were advised, so we continue to keep that information out to parents so they're aware. The other case was related to that case as well in the school. So it was a situation where we noted that there was no spread within the school or within our classrooms. So we were we really reassured ourselves that although we know there continues to be a risk, that what is important is that the measures that we have put in place, which are of course the masking, distancing, keeping our students in the bubbles at the elementary level, doing the health monitoring checks, daily checks, have been, these measures have continued to support us and ease our minds as we reopen our schools. The other information is in the other situation that we had with COVID. There too, it was contained. There was no spread within the school. So that data, that information is one factor, a major factor that led us to make the decision to reopen our schools. The other thing that we really monitored is important was the attendance rate too. We wanted to see and gauge what parents' comfort level is. Do we need more communication? And what we did see is that throughout the week, parents were definitely more at ease with having their children come into school. The attendance rate did rise. When we did put out the initial information asking parents whether they were going to choose to have their children come on site during this period or remain home with packages, the large majority of parents chose to have their children come on site. So that indicates to us that our parents do have a comfort, are secure, knowing that our schools are putting together the best care and preventative measures for their children. So that also was a factor that we could see that parents knew their children were entering a safe place. Parents were quite aware and understanding that their children need to be in school, educated amongst their peers, socialize, and be emotionally, socially, that's important for their growth. So these were some of the data that we looked at. We also looked closely at, what was happening in the community. We knew that there's factors occurring. We're not working in isolation. It's important that parents know that we are working with Kahnawak's local public health. We are looking at what's happening around us in the province. We are looking ahead at the reopenings that are occurring in community. So these are all factors that we take into account when looking at reopening our schools. So, and we will continue to keep all these processes in place in the next few weeks. So that was also something important that we took into consideration and will continue to take into consideration. I guess the last, one of the things that I know Falen will stress on is the fact that within our schools now, in order to do any contact tracing, in order to identify cases, the relationship now and who that is left in terms of the responsibility is between parents and is between the schools now. Yes, we still have local public health to guide and support us, but that communication from parents, monitoring their children, looking at their symptoms, contacting us, keeping us abreast of what's happening, that is very, very important. And our schools are now monitoring, keeping the data, seeing what's occurring, and communicating with our stakeholders as well. So I'm going to end there, and I, just to say that I am very pleased and proud of all the work that has been done this past month to get us to where we're at. And I'm pleased with the collaboration and continued collaboration that we're going to have with community, parents, local public health, and teachers, educators, and everyone else who has been part of this collaboration. So next, what I'm going to do is I will invite Falen Jacobs to come. And as I said earlier, Falen is going to be talking more in terms of processes between schools and the parents when identifying or there's an indicator that there is a potential case of COVID-19 and how we'll work together. So Niawagowa, and just wish the best for everyone, and have a good afternoon.
Skana Ziwagwego, Iakowennaié was Falen Jacobs Yujats, Waganyaktu ni Wagit Delaronde, Danu Kahnawake Education Center Wajote. Wagatsununi Zigon Iges Nuwa. So I just wanted to say hello to everybody. My name is Falen Iakowennaié Jacobs. I am presently the Associate Director of Education for the Kahnawake Education Center. And in collaboration with Robin today, we wanted to present to our parents and community some updates to some procedures that we've identified over the last few weeks. So on January 14th, we put out a communique to our families and community that kind of went over symptomatic procedures. So for the KEC, identifying a student with COVID-19 now falls within certain categories. So either COVID-related symptoms identified at home, verified using a rapid test, COVID-19 related symptoms identified at home, identified at school with a test administered from school personnel or safety monitors, as well as COVID-19 related symptoms identified at home where no tests were available or given. So we outlined, and all of this information is available on our websites and on our social media pages and individual school pages, but I just wanted to go over what we established before, which still remains the same. So we went over some what you need to do, procedures that you need to follow for an adequately vaccinated individual 12 years and over, for an unvaccinated individual 12 years and older, as well as for children under 12 from nursery to grade 6. And as well in that document, you'll find our case management procedures. So basically, who else should be isolating within your home. So that is a very detailed document that's very important. We want to stress the fact that you refer to that as families, and it's very clearly labeled and identified what you should do in each case. So today, I wanted to present to the community about our updated case management in schools. So I'll start first, if we can put up the elementary graph. So it's elementary student, so what happens for our elementary student identified with COVID-19 while at home? So for elementary schools, so basically a KEC parent reporting COVID-19 and case management process. So if this situation happens to you at home, this is how we want to proceed. So I administered a rapid test on my child in the evening or on a weekend, and it was positive. What do I do, and who can I contact to advise? So what we want you to do at the elementary level for Garuhinunha and Kateri is to private message your child's classroom teacher on Class Dojo. And basically, we want you to leave your contact information, and the teacher will advise the school administrator. So after that, we move down to case management. So then the school administrators will take over that responsibility, and they will call you to gather more information. You will be advised of the next steps and will be provided with further support if needed. Then we move down to the isolation and return to school. So the school administrator will advise you of a tentative date of a return to school for your child and procedures to follow. Basically, those procedures are related to the document, the communique that we released on January 14th. And also, we will identify other children in the home who would need to isolate, an isolation protocol for all. And then also to discuss school assignments, you know, if a student is at home, different school assignments that they can work on while they're in their isolation period. So in order to return to school, on the 6th day, we want to schedule a rapid test appointment. That will be done at school with our school safety monitors. I wanted to stress the fact that our school safety monitors at all 3 schools are adequately trained in administering the rapid tests. And now I think we've all had a lot more exposure to rapid testing at home, so we're a little more comfortable with the process. It's not as invasive as previous tests were, so we all are a little more comfortable with that. Students can return to school if the rapid test is negative on the 6th day and with no symptoms or fever. And for people, we do understand that some families may not consent to have their children rapid tested at our schools, and we do support that. So for those students, they would need to be a 10-day isolation period if there was no consent to rapid testing. So next I'll go to our high school procedure, which is very similar with some minor differences. So for Kahnawake Survival School, same situation. As parents, you administered a rapid test on your child after school hours or on the weekend, and it was positive. So who should you contact to advise? So number 1, we would like you to private message the KSS Facebook page advising them of the positive result, and for you to provide contact information. Or the second option is that you can email the school administrator, Jackie Leclerc, at jackie.leclerc@kecedu.ca and provide information, the information that we are requesting. So the next step is that the school administrator will call you to gather a little bit more information about your situation, and you will be advised of the next steps, and you will be provided with further support if needed. So for isolation and return to school, very similar to our elementary schools, the school administrator will advise you of the tentative date that your child can return to school and the procedures to follow. Identify other children in the home who attend school and the isolation protocols for all in your home. Since everyone in your home is considered a high-risk contact, and to discuss school assignments while isolating. For a return to school, you will need to schedule a rapid test appointment on day 6 with the school. Again, that would most likely be with the school safety monitor. And a return to classroom if the rapid test is negative and no symptoms and fever. And for unvaccinated students, it remains the same as an isolation period for 10 days. So these are new procedures that we wanted to put in place, very clear and concise. We wanted it to be very user-friendly for our parents on what to do specifically if you do identify a positive case on a rapid test at home. So these documents will also be posted to our social media pages and will be shared through our school websites and released to the community as well for your reference. So please, these documents are very important for you as parents for reference. So you know, you can save them, print them out, take screenshots, whatever you need to do to have that information accessible to you. And of course, if you're ever questioning or unsure of some of the procedures or the instructions, please reach out to the schools, the school administrators, reception, safety monitors, and we can get that cleared up for you. We just wanted to stress the fact of how important it is to let us know of a positive rapid test. Like Robin mentioned previously, our best effort in eliminating, or not eliminating, I should say, preventing spread in our schools is in collaboration with our parents. So please don't hesitate, even if it's late at night or it's the weekend, you know, and you might say, maybe I'll wait till Monday to report the positive case, or I'll wait till tomorrow. We are really strongly suggesting that you reach out to the school personnel in the ways that we've identified on the graphs. This way we can spring into action immediately. There are different things that need to get done. There are protocols in place. Each school has a COVID-19 response team. So that protocol gets activated, and members of the the COVID-19 response team, they have different duties and things that they need to do in order to ensure a safe environment for our students and staff. So once you advise of a positive test, then there are certain procedures that need to roll out, especially extra disinfection to the classroom and other identified areas that a positive case may have been within the school. So that's for what happens at home. Of course, there will be situations where a positive case may be identified by rapid test by our safety monitors in the school, and in that case, we'll you know, you will be advised. There's certain procedure for that as well. And if, let's say, the class is in session at that time, we would move the students to another room, maybe take them outside, and proper disinfection of the classroom and procedures would follow in that sense. So that's what I wanted to present to you today, just our updated case management in schools and what you need to do as parents. So again, I just wanted to stress the fact that Robin related that a collaboration moving forward is so important for us in you identifying positive cases, keeping your children at home if they do develop or experience symptoms, and really it's just decisions that we make as an organization are through collaboration with administration, with local public health, watching the situations around us as they unfold and making the best informed decisions for our organization moving forward. So I just wanted to also, before I leave, I don't want to take up too much time today, is to thank our teachers, our administrators, student services teams, all school personnel, and all KEC staff. Because the last 2 years, teaching in general is a very, it can be tough. It's a tough profession. But teaching during a pandemic has been extremely difficult. And I wanted to acknowledge all of our teachers, like I said, and all of our KEC personnel and our staff, whether you're in an office or, you know, you're a consultant or you're working in HR, or, you know, basically everybody in our organization plays an important part to the success of our schools and bringing our mission and our vision forward, as well as keeping our students and our staff and our families and our community safe during these times. So I just wanted to thank our teachers and our staff and really acknowledge all of the hard work and the efforts that they've been putting in during the pandemic and adapting to these new changes as they come, because we realize that things can change quite rapidly. So just really thanking them. And moving forward, we'll be going into Teacher Appreciation Week, which is the week of February 7th to 11th. So don't hesitate to let the teachers in your lives and the educators and staff know how much you appreciate them during these times. It's definitely time, you know, and to acknowledge them, not just during Teacher Appreciation Week, but at all times. So Kahnawake to everybody, and I look forward to presenting you with more updates and working collaboratively moving forward. Kahnawake.
Thank you very much, Falen and Robin. Certainly a great example of collaboration between education system and the local public health, and leading to what has been very successful opening thus far, and all indications are that things are going to continue to go well. And that's obviously everybody's hope and everybody's path forward that they want to see. And opening up of the schools and seeing the impacts on the community, is also one of the points that as a task force that we look at, because we knew when the schools were going to open that there was a potential impact on the community, and we didn't want to move too quickly, relieving or modifying other measures, until we are able to see the fact of impacts of opening the schools. And as Robin had just outlined, it's been very successful, and there's been very few cases of COVID amongst the children. So again, very positive, because if we have large outbreaks, we understand that it ripples across the community. Parents got to stay home, then the parents can't work. A lot of those parents may be frontline workers, essential workers, or just need to make a living. So we have to be careful and mindful of that. So just as much as education was watching what's happening in the community, we were watching what was happening in education. Again, a very good collaborative effort, and that's part of the role of the task force, is to look at the entire picture moving forward. So again, excellent work to them for the steps they took so far. And with that, in seeing the impacts or the minimal impacts from opening up the schools, the positive impacts, I should say, and the fact that the essential services, impacts on essential services, and early on in the Omicron wave, and frontline workers has stabilized. That was again another factor that allowed us to make the decisions last week to look at reopening of the businesses that were impacted by closures in December. So that was discussed last week, and then this week, after seeing the projections, we again decided to turn the key, so to speak, give the green light, and made the announcement on Tuesday that the businesses can start reopening back at a 50% capacity. There obviously, as we always do, there will be an ongoing evaluation. So in 2 weeks after opening, we will be again assessing where things are within the community, and then deciding next steps. And hopefully those next steps will be continuing down the path of easing measures and modifying any type of restrictions. But again, that's something we do on an ongoing basis. But we certainly will revisit that in 2 weeks' time. So again, everything is looking as positive, I guess, as we can at this point in time. If the trends continue the way they're anticipated, again, we could sigh a slight of relief, but not put down our guard and not kick open the door, so to speak, and move too quickly. But again, moving very carefully. As another important factor I want to relate to the community, again, is about the rapid tests. Maybe it's not a factor, but one fact, I should say, is we did, and I'm pleased to announce today that we did receive over 12,000 rapid tests that we will be in the process of distributing to the community, much like we did last time. They already are being distributed to the education facilities in the community and such, but we're working out all the logistics, and those will be available to the community very shortly, and we'll put more information out on that in the next little while. Also, I wanted to mention the fact that the vaccination, mass vaccination center over at the Bingo, as previously announced, the last day is tomorrow. It's operating as we speak now until 7 p.m. this evening, and again tomorrow from 9 to 4:30. So now again here is the opportunity for Kahnawake to go right on our back door, to get your vaccination. Again, whether that be first, second, or third dose at any age. So if you're eligible, we again obviously certainly encourage you to do so. And then again, the opportunity is right here in the community. There's a tremendous amount of human resources that's dedicated out there. So please utilize them effectively. And along the same lines as vaccination, and I want to speak a little bit about that, because there is some, I guess, maybe some confusion or some misinterpretation of some of the information about hospitalizations and vaccination versus non-vaccinated, and some of the stuff you hear in the media about, roughly 50% of the population, 50% of the people in the hospital are unvaccinated, and the other half are vaccinated. So some people, feel, say, well, what's the point getting vaccinated if half the people in the hospital are vaccinated and the other half are not? But I just wanted to, because we did give an update to the task force yesterday, and there was still wasn't as clear as we hoped. So I pulled together a graph that I want to pull up on the screen that I just want to show the community, to try to maybe make it a little bit clearer in terms of what we mean. And these are numbers we pulled together this morning on population in Quebec. And if you look at the overall population of Quebec is roughly 8.6 million people. And out of those 8.6 million people, roughly 7.7 million of them are vaccinated, and 860,000 are non-vaccinated. So roughly 90% of the population has at least one dose, and 85.5%, so almost 86% of the population is fully vaccinated. But if you look at numbers from yesterday, and you see that there was 3,270 hospitalizations, and you see 50% of the hospitalizations were people, roughly, these are estimates, not exact numbers, but roughly 50% of the hospitalizations were from vaccinated people, and 50% were non-vaccinated. And this is where some people interpret this and say, well, what's the point being vaccinated if it's equal amount of people in the hospital? But if you look a little further, you say, but the total population of vaccinated people is 7.7 million people are vaccinated. So if you split those 3,270 vaccinations into the two groups, so you have 1,635 people out of 7.7 million people in the hospital, versus the unvaccinated, where you have the 1,635 people coming out of a pool of only 860,000. So that shows you that being non-vaccinated, you are 10 times more likely ending up in the hospital if you do catch COVID. So that's one of the key reasons why we keep emphasizing the importance of people to get vaccinated. Yes, you may still get COVID, but the chances of you ending up in the hospital are much, much less than those of who are non-vaccinated. We'll put this chart up there. Again, the numbers are not 100% accurate by a percent or two, but this gives you a good picture of the rationale why vaccinations are still a cornerstone for us to see our way safely through the remainder of this pandemic. So with that, that's all I have for this afternoon. It's been quite a lot of great information regarding education. We will be back next week. We will provide more information, again, ongoing assessments, and we're glad, again, to see next Monday that many of the businesses are going to be resuming activities, and we'll reassess that in the coming weeks. So with that, Iakowennaié, Tana, Onigiwahi.